Hey, if you're a new parent, you've probably heard the word colic. And if you're actually living through it right now, you know it can be one of the most stressful things imaginable. So today, we're going to break it all down. We'll use clear, simple facts to understand what colic is, what it isn't, and most importantly, how you and your family can get through it. Let's dive in.
All right, first things first. What are we actually talking about when we say infant colic? It's a term that gets thrown around a lot. So let's just get a really clear, precise definition to cut through any of that confusion. Now, pay close attention to the specific words here, unexplained and healthy baby. And those words are so important, because right away that tells us this isn't about your baby being sick, and it's definitely not about something you've done wrong. Colic is just a distinct phase that a perfectly healthy little one can go through.
And if you are going through this, you are so far from alone. I mean, look at this. Colic is incredibly common. It affects about 1/3 of all infants. So while it can feel totally isolating in the moment, just remember there are millions of other parents out there experiencing the exact same thing. So, how do you know if it's really colic? Well, there's a classic pattern. You might hear it called the rule of threes. We're talking crying for at least 3 hours a day, for at least 3 days a week. It also has a habit of striking in the late afternoon or evening. And you might see physical signs too, like your baby pulling their legs up or clenching their little fists. Just recognizing this pattern, even though it's tough, is the first step to managing it. And this right here, this is probably the most important thing to see. It's a reminder that colic is temporary. It has a beginning, a middle, and an end. That 10-week mark might feel like the absolute peak of it all, but you can see that there's a clear end in sight around 16 weeks. This is not forever.
Okay, so knowing the timeline helps a ton, but understanding colic also means knowing what it isn't. There's just so much guilt that gets wrapped up in this whole thing, so let's use these next few slides to tackle that head on.
This is the question that just haunts parents during those long crying spells. Did I do something wrong? Am I a bad parent? Is my own stress causing this?
Let's be as clear as humanly possible. The answer is no. Absolutely 100% not. It is not your fault. This is so important, it's worth saying again. The baby will thrive, the condition will pass, and you, the parents, are not responsible. Just let that sink in for a second. This is a phase your baby is going through. It is not a reflection on your parenting.
So yeah, let's bust a few more myths while we're at it. It's not caused by your anxiety. It's not caused because you're using formula. And it's generally not caused by food allergies. Believing these things only adds a layer of guilt that you just do not need right now.
Okay, so we've cleared away what colic isn't. Now, let's focus on what you can actually do. This whole next section is about practical, hands-on things you can try to help soothe your baby when they're having a tough time.
The first thing to think about is the environment. Basically, you want to reduce stimulation. A newborn's nervous system is still figuring things out, and it can get overwhelmed pretty easily. For a colicky baby, that sensitivity is turned way up. So just dimming the lights, putting on some quiet music, and moving slowly can create a much calmer space. Next up is active comfort. This is all about motion and closeness, which can kind of mimic that soothing feeling of being in the womb. Gentle physical contact is your best friend here. Cuddling, wearing the baby in a sling, or even just a simple walk around the block can sometimes work wonders. A pacifier can also be a real help, since that sucking motion is naturally calming for babies.
Now you might be wondering, what about medication? You'll see things like wind drops at the pharmacy, but the general medical advice is that drugs aren't the first step. For really severe cases, a doctor might prescribe something, but this has to be a conversation you have with the medical professional, never a decision you make on your own.
Of course, one of the biggest questions parents have is about feeding. You start to wonder, is it something my baby is eating? So let's take a look at the connection between feeding, digestion, and colic.
When it comes to the feeding itself, there are a few techniques you can play around with. First, feeding on demand helps make sure the crying isn't just from hunger. Burping really well and trying posture feeding, which just means keeping the baby more upright, can help as swallowed air. For breastfed babies, some people find expressing a little of that watery foremilk first helps. And for formula-fed babies, if you suspect an intolerance, a lactose-free formula might be something to discuss with your doctor or nurse. Now, the topic of a breastfeeding mother's diet can be a bit controversial, but it's worth mentioning as a possible trial. Some moms find that if they avoid certain foods, especially things like cow's milk products, it seems to help their baby's colic. This is absolutely not a guaranteed fix, but it's an experiment you could consider if you're looking for things to try.
We've spent a lot of time focused on the baby, and that makes sense. But this last section, this is just as critical. Let's talk about you. Because, as they say, you cannot pour from an empty cup. And surviving colic is just as much about your well-being as it is about soothing the baby.
Please listen to this carefully. Your health matters. Get rest whenever and wherever you can. And this might be the most important piece of advice you hear today. It is absolutely okay to put the baby down in a safe place, like their crib, and walk away for 10 minutes if you're feeling overwhelmed. Taking that space is a sign of good parenting, not failure. And please, talk to someone about how you're feeling. Frustration is normal, and you are not a bad person for feeling it.
If you take only one single thing away from all of this, let it be this. This is the mantra you need to repeat to yourself in those toughest moments. It is no one's fault, and it will soon settle.
So the big takeaway is that colic is temporary. But it does leave us with a bigger question, doesn't it? We put so much focus on trying to fix the baby's crying. But maybe the real work is in figuring out how we, as friends, family, and professionals, can do a better job of supporting the parents who are right in the middle of this incredibly challenging journey.